focused on reproductive system embryology, each with 4 answer choices and detailed explanations. Reproductive Embryology Clinical Vignettes. Development of male and female reproductive systems. A newborn male is diagnosed with persistent Müllerian duct syndrome, PMDS, despite having a normal 46XY karyotype and external male genitalia. He has a uterus and fallopian tubes. What is the most likely cause of this condition? A. Androgen insensitivity syndrome. B. Failure of Sertoli cells to produce Müllerian-inhibiting substance, MIS. C. 5I reductase deficiency. D. Klinefelter syndrome. Answer: Sertoli cells to produce Müllerian-inhibiting substance. Explanation: PMDS occurs when Sertoli cells fail to produce MIS, also called AMH, anti-Müllerian hormone, leading to the persistence of Müllerian structures, uterus, fallopian tubes, despite normal male development. #2. Gonadal development, Turner syndrome. A 14-year-old girl presents with short stature, primary amenorrhea, and a webbed neck. She has a 45X karyotype. Which structure is most likely affected in her gonadal development? A. Müllerian ducts. B. Genital tubercle. C. Wolffian ducts. D. Ovarian follicles. Answer: D. Ovarian follicles, sus. Explanation: Turner syndrome, 45X, leads to streak ovaries, which are non-functional due to accelerated oocyte loss in utero. 3. Male external genitalia, DHT deficiency. A newborn male presents with ambiguous genitalia but normal testes and a 46XY karyotype. At puberty, he develops male secondary sexual characteristics and his phallus enlarges. What is the most likely diagnosis? A. Androgen insensitivity syndrome. B. 5-alpha reductase deficiency. C. Klinefelter syndrome. D. Congenital adrenal hyperplasia. Answer B. 5-alpha reductase deficiency. Explanation: DHT dihydrotestosterone is required for male external genitalia development. 5-alpha reductase deficiency leads to underdeveloped male genitalia at birth, but normal pubertal masculinization due to testosterone production. 4. Paramesonephric, Müllerian, duct defects, uterine anomalies. A 25-year-old woman with a history of recurrent miscarriages undergoes an ultrasound, which reveals a bicornuate uterus. Which embryologic structure failed to fuse correctly? A. Wolffian ducts. B. Müllerian ducts. C. Genital tubercle. Cloacal membrane. Answer B. Explanation: a bicornuate uterus results from incomplete Müllerian paramesonephric duct fusion, leading to uterine abnormalities and recurrent pregnancy loss. #5. Disorders of sexual differentiation. Androgen insensitivity syndrome. A 16-year-old girl presents with primary amenorrhea, normal breast development, and no uterus on ultrasound. Her karyotype is 46. What is the most likely diagnosis? A. Turner syndrome. B. Androgen insensitivity syndrome. C. 5-alpha reductase deficiency. D. Müllerian agenesis. Answer B. Androgen insensitivity syndrome. Explanation: in AIS 46XY, testosterone cannot act due to androgen receptor defects, leading to female external genitalia but no uterus vagina. 6. Neural crest migration, congenital adrenal hyperplasia. A newborn girl presents with clitoromegaly and virilization. Lab results show low cortisol, high 17-hydroxyprogesterone, and high ACTH. What enzyme deficiency is most likely responsible? A. 17-hydroxylase. B. 21-hydroxylase. C. 11-beta-hydroxylase. D. 5-I reductase. Answer B. 21-hydroxylase. Explanation: 21-hydroxylase deficiency causes virilization in females, salt wasting, and increased androgens due to defective cortisol synthesis. 7. Urogenital sinus derivatives, hypospadias. A newborn male presents with a urethral opening on the ventral shaft of the penis. What embryologic structure failed to develop properly? A. Urogenital folds. B. Genital tubercle. C. Müllerian ducts. D. Mesonephric ducts. Answer: A. Urogenital folds. Explanation: hypospadias results from failure of the urethral folds to fuse, leading to a ventral urethral opening. 8. Genital tubercle defects, epispadias. A newborn male is diagnosed with bladder exstrophy. His urethral opening is on the dorsal surface of the penis. What embryologic defect is responsible? A. Failure of genital tubercle positioning. B. Failure of the urethral folds to fuse. C. Failure of Müllerian duct regression. D. Abnormal Wolffian duct migration. Answer A. Failure of genital tubercle positioning. Explanation: Epispadias are due to abnormal positioning of the genital tubercle, leading to a dorsal urethral opening. 9. Persistent cloaca, abnormal cloacal division. A newborn girl has a single perineal opening for the urinary, genital, and gastrointestinal tracts. Which embryologic process failed? A. Müllerian duct fusion. B. Urorectal septum formation. C. Mesonephric duct differentiation. D. Genital tubercle development. Answer: B. Urorectal septum formation. Explanation: Persistent cloaca occurs when the urorectal septum fails to separate the rectum from the urogenital sinus, leading to a single opening. Nashar 10. Gonadal descent, cryptorchidism. A 3-month-old male has an undescended testis. What structure guides normal testicular descent? A. Müllerian duct. B. Wolffian duct. C. Gubernaculum, urogenital sinus. Gubernaculum. Explanation: The gubernaculum guides testicular descent into the scrotum. In females, it becomes the round ligament of the uterus. Key takeaways for reproductive embryology: Müllerian ducts, paramesonephric ducts, female structures; Wolffian ducts, mesonephric ducts, male internal structures; Sertoli cells, secrete MIS, inhibits Müllerian ducts; Leydig cells, secrete testosterone, develop Wolffian ducts; DHT, male external genitalia, requires 5,5 reductase; Gubernaculum guides gonadal descent; Hypospadias, failure of urethral folds to fuse; Epispadias, failure of genital tubercle positioning. Would you like clinical vignettes on placental development and